with our emergency preparedness training. And on to the next slide, please. There's kind of an overview of what we'll be doing today. So we'll be starting off with an icebreaker of like a would you rather game. And then you'll be learning about what Med101 does, our goals, what we do. And the 3 activities that we'll be learning today is how to perform the Hammock Maneuver, how to treat burns, and also how to recognize strokes.
So before we start, let's play a tiny icebreaker of Would You Rather. So I'll be asking you guys a few questions and you can either type in the chat or just speak out and tell us which option you choose. So first we have, would you rather lose the ability to read or would you rather lose the ability to speak? You guys can type in the chat or just say it.
Hi, for me, I think I would rather lose the ability to read. I feel like I'm a very I really like speaking. So then I feel like it would really be like, I don't know. I don't know. A lot of people in the chat are saying they lose the ability to speak. Some say to read.
Honestly, I don't know. I think I'd probably lose the ability to read instead of speak. It's tricky.
Cool. Hamangi says that she would rather lose ability to read because communication is really important and she's always talking. Nice.
But then Christiane said knowledge is power. Okay, so the next one we have is, would you rather always be 10 minutes late or always 20 minutes early?
I feel like this is an easy one for me. 20 minutes early because I feel like it's really bad. It's like people look at you like badly if you are always 10 minutes late. So I always want to be 20 minutes early, but at the same time, it's kind of awkward to like sit around, like stand around. But yeah, a lot of people are saying 20 minutes early.
Saying early. That's I was gonna say I would rather be 10 minutes late.
Why?
Because like, what's the point of being there 20 minutes early when I can just be like 10 minutes late and everything usually starts late anyways? So I'm not gonna be missing a lot in like 10 minutes.
I was going to say that I would choose to be 20 minutes early in case there's an exam and the professor, let's say at like a university, is very punctual, then I wouldn't want to miss any important information.
Yeah, I see that. I just want to be fashionably late, I guess. Okay, let's go to the next one. So would you rather have all the traffic lights you approach to be green or never have to stand in line again? For me, it's probably gonna be never have to stand in line again, because what if I went to like an amusement park and then I have to stand like hours in line, but like if I don't have to stand in line, I could just enjoy like go through all the rides in one day. And like traffic lights, like it doesn't take that long. Like max could be like 4 minutes, I guess.
But like, okay, if you think about it, like you can cut so much time. Like I feel like if I was like working or something, I'd be like driving every day. And then it would be so like I could cut time. Like I could be like using that time to eat breakfast or something and then just like I feel like it'd be better for me to have like all green lights.
It could be useful for like daily things, I guess.
But I also like hate like amusement park lines. It like Disneyland, it's really bad.
All right, so what is Med101? We are an educational club that aims to provide students with exposure to health professions they may be interested in pursuing, as well as opportunities that give them a better understanding of the medical field. We offer webinars featuring guest speakers specializing in different medicine-related careers, and we also provide interactive online activities that students can participate in the safety of their home during these unpredictable times.
So right before we start our little kind of training webinar today, I do want to mention a little disclaimer. For me, I got CPR certified earlier this year in January, but Catherine Shagun and I are no means any licensed for like CPR training or emergency or any of the emergency skills that we're teaching you guys. But we have been extensively researching these types of techniques and have been like obtaining them from like American Red Cross and those other organizations. So, but we are in no way like medical professionals or emergency specialists in these fields. So we highly encourage you guys to get the proper training and certifications before you guys begin at like attempting these different techniques. So the first training or the first little activity that we're going to be starting today is Hammock Maneuver. And so everyone kind of knows, I feel like everyone has already experienced like choking themselves, or like they already know that experience. But just to put it in medical terms, choking is like a foreign body obstruction. And so it's typically caused by like if you eat like food and then you eat it too quickly or something like that, then it gets stuck in your throat. Or if there are like small objects that get stuck in your throat, that can happen as well. And what happens is it can either be a full or a partial blockage in your throat. And what it does is it prevents oxygen from entering your body, and it blocks any of the oxygen reaching your lungs and also your brain. And so it just, even though it might seem like a really like foolish way to like die or something, choking is actually the fourth leading cause of death from accident. So it kind of gives you like a perspective of how many, I think in 2016, there was nearly 5,000 deaths due to choking in the US alone. And it just kind of goes to show how easy it is to choke and potentially like die or anything from that. So here are just common causes of choking. So definitely food is the number one. So like for me, I think like it's like milk tea, like the like boba. If it's like really chewy or something and it gets stuck in my throat, then that's with me. Peanut butter, like popcorn, all of those kinds of foods also can get stuck in your throat. And especially in edible items for like children, like if they like accidentally swallow coins or like rubber balls or really small toys, then they can actually choke from that. And also disease and allergic reactions can cause choking. So we're just going to go into two types of choking, and we'll actually be performing the ways that you can, what you can do in those situations. So for today's webinar, we'll be focusing on like how to treat an adult who's choking. There's different ways that you treat infants and different ways that you treat children, but today we're just going to be focusing on adults. So the first type of choking is mild choking, and you can see from the different kinds of signs you can look out for on the right, it's like a partial blockage and you're still able to breathe a little bit. So you might be gagging, you might be wheezing, and you might be able to speak a little bit. So in this situation, you would want to encourage the person to cough really hard to clear that blockage. And also you'd want to perform back blows in the middle of their back and in between their shoulder blades to dislodge the object. The next type of choking is the more severe choking, and this is when it becomes a medical emergency. So you can look at the signs on the right. That's when you have like you can't really speak at all. Maybe you have really blue, like your fingernails become blue or something because the lack of oxygen. In this situation, if the adult can talk a little bit, if they're able to if they're like kind of conscious and they're able to talk to you, then you want to approach them and ask them, may I help you? Can you breathe at all? And it will actually be, we'll be trying this out in the next slide when we do when we practice the Hammock Maneuver. But once you ask them, you always want to ask for their consent. That's the first thing they should always ask for. And then you always look for the universal signs of choking. So usually the sign is like a crossed arms, crossed hands over your throat, and that's usually the sign. If their fingertips are blue, or if their lips are blue, or if they're trying to put their fingers in their throat, that usually means that they want to try to vomit. And if they lose consciousness, then that usually indicates that they are lacking oxygen. So in the instance that the adult cannot talk, then you would actually you'd ask someone to call 911, and then you'd want to do the back back blows, like I said earlier, with mild choking, and then you want to perform the Hammock maneuver. So in this case, you'd perform both of those activities, and then you kind of keep going back and forth, 5 back blows and 5 abdominal thrusts until 911 arrives, or if the person becomes unconscious, or if the object is removed. If in the instance that the victim passes out or anything like that, then you'd want to roll them to their side so that any like vomit or spit doesn't go into their lungs. And then if the victim stops breathing or they don't have a pulse, then that's when you'd perform CPR. So today we won't really be doing, like, we won't be performing CPR, we'll be more focusing on like the Heimlich maneuver. But I believe like the other clubs will be performing kind of like those other things too. So here are just some like fun facts. The Heimlich maneuver was actually discovered in 1974 by Dr. Henry Heimlich. And then between 1986 and 2006, the Red Cross only really recommended the Heimlich maneuver, but then they decided to change it to include both the back blows and the abdominal thrusts, or the Heimlich maneuver, in 2006. And so it's kind of weird because there's a lot of controversy behind the Heimlich maneuver. I think Dr. Heimlich was kind of like, he didn't really want to encourage the back blows because he thought it was really dangerous. But after doing a lot of like tests and studies like that, the American Red Cross and like other organizations, they didn't really like there was nothing that said that back blows were not effective. So then now American Red Cross, they perform both back blows and the Hammock maneuver. So we're going to be watching this this video, and the medical professional doesn't perform the back blows here, but we'll just see how he performs the Hammock maneuver, and then we'll actually be performing it right after this.
Now let's cover the highly effective and very important skill called conscious adult choking. Now in this scenario, we have someone who was eating at a table. They began to choke. We know they were choking because they could not cough, they could not breathe, they could not speak. This is a full obstruction and it needs help if it's going to come out in most cases. If it's easy to activate the emergency response team or call 911, great. But if not, we can wait until the patient goes unresponsive before we actually take the time to call 911 or activate a code. But in this case, we're going to come up to the person, we're going to look them in the eyes. Are you choking? They nod yes. I know how to help you. May I help you? They give me permission to help them. They're still conscious, and so we want to get that permission from the patient if at all possible. Now I'm going to elevate their elbows. I'm going to find the belly button. The belly button is my landmark so that I can tuck my thumb in and put the fist just above the belly button on their abdomen. I want to stay below the xiphoid process, which is approximately right here. I want to stay just above the belly button because this is where I find the diaphragmatic region. This is exactly what I want so that I can bring that diaphragm up and in while I compress the lower lobes of the lung, shoot the air up the trachea, popping that object out, and it's effective the majority of the time. So I'm going to take that hand, keep my elbows out so I'm not on their ribs any more than I have to be, and I'm going to start with my inward and upward thrusts. And I'm going to do these thrusts until either the object comes out or the person goes unresponsive. In this case, the object did come out. He began breathing, coughing, clearing his own airway. I simply re-encourage him that he's doing fine. If he feels like sitting down, we could have him sit down. And if we had not already called 911, now would be the time to call 911 or call a code if they go unresponsive. If we've already called 911, keep them coming. It's fine. Even though the object came out, it's always a good idea to have EMS stay on the way so that if this person opts not to go in, they can be checked out by the EMS professionals. They're going to check airway, they're going to check some lung sounds to make sure there's no partial obstruction, and they're probably going to do a quick assessment to make sure there's no internal bleeding from the abdominal thrusts. So if the individual does not opt to have that done to them or the EMS providers do not come, I always like to encourage them to go to their own practitioner and just be looked over and made sure that everything is okay. Keep in mind that if this person were not to have the successful removal of the obstruction, they would probably go unresponsive in a short amount of time. And it's then that we would assist them to the ground carefully and begin the skill of unconscious adult choking.
All right, cool. So if Adder, can you stop screen sharing for a little bit? So right now we're gonna actually be practicing how to do the hammock maneuver, and we'll wait a little bit for you guys. If you guys can, you can try like encouraging your sibling or your like parent to come over to like practice or something. We're not gonna actually perform it, but just like go through the kind of the steps. And then if not, then you can use like a pillow or like a stuffed animal or something. Just use something else. But we'll actually be like practicing a little bit. Wait like maybe 30 seconds in case you guys want to do that. And then feel free to like show your video so that like we can like talk through it. And then we'll be trying that. So wait like around 30 seconds more. All right, cool. So I'm actually asked my sister to help me. Okay, she can help me now. So we're actually gonna try it out. If you don't feel comfortable showing your video, it's okay. But we'll go through the kind of like steps to do it. And again, this kind of just goes over, exposes you to what you'd have to do in the situation. But again, we really highly recommend you to get like proper training and any certifications before you start doing it. So the first thing you'd want to do is assess the situation. So the universal sign of choking is like covering the throat like this. So you have your like volunteer do that, and then you're gonna position them like this. And so in a scenario, we're gonna be talking about like severe choking. So this is when they perform hammock maneuver and the back blows. So the first thing you want to do is ask them, "May I help you? Are you choking?" So usually if like you see them like nodding or something and they can't speak at all, or if they try to cough but they can't do anything like that, then that means that it's like a full blockage. And then what you'd want to do is first you start off with 5 back blows. So you stand perpendicular to them, kind of here, and then you take your non-dominant hand, or your left hand for me, and then you put it underneath their arm and over their chest so that they're able to act like a seatbelt for them. And then you want them to bend at their torso so that the torso is perpendicular to the ground, or parallel to the ground. And then you'd perform the back blows. So you take the heel of your hand, and then what you want to do is you're going to hit them right in the middle of the shoulder blades. So what that's going to do is going to dislodge the object, and it's going to try to like remove it. So then you perform the 5 back blows. So I'm not going to actually hit her, but you perform 5, 1, 2, 3, 4, 5. And then after that, you make them stand up, and then that's when you perform the Hammock maneuver. So now you're going to ask them, "Can you find your belly button for me?" So they're going to point to it. And then you're going to take your 2 fingers from your non-dominant hand. So it's for me, it's my left hand. And you're going to place it right above your other fingers where they are right now. And then you're going to take your other hand, your dominant hand, and make a fist. So in the video, he puts it in like this, but you can make it a fist or you can make it inside here. It works either way. So then I'm going to go like this. And then right where my 2 fingers are, I'm going to put it over there. So right underneath their arms. And then I'm going to hold the other hand. So this is my non-dominant hand that have my 2 fingers. I'm going to cover it over here. So it kind of looks like this. So then it kind of looks like this. It's right next to their stomach. Your thumb is going to be right next to their stomach. So then you're going to have it like this. And then you're going to have like a ice cream scooping motion. So you're going to push in and up. So it's kind of like this. So then that's going to push the air from the lungs the diaphragm up, and it's going to shoot the object out. So then you'd be performing that 5 times, 2, 3, 4, 5, and then after that you go back to the 5 back blows, and so you keep doing that back and forth, 5 back blows and then 5 abdominal thrusts until 911 arrives, until the person becomes unconscious from the lack of oxygen, or if the object is massaged. So then, yeah, that's just like a quick overview of like the Hammock Maneuver. So with that, we'll go into like how to perform the Self-Hammock Maneuver, and then if you have any questions, or like if you want me to like redemonstrate that, then just let me know, and then we can continue with the Self-Hammock Maneuver. Adrian, can you start screen sharing again? Okay, cool. So this is like a Self-Hammock Maneuver in case you're alone, like if you're by yourself or anything like that. So what you want to do is you call 911 and you just leave the phone call on, and you want to try to cough up the object, and then we'll actually see in the video how she performs the Self-Hammock Maneuver. And then after that, you should always seek medical help in case you accidentally injured yourself, or in case not all of like the food particles or not all of the object like is removed from your lungs, in your throat, I mean. So we're gonna be watching this video.
So what do you do if you're choking and you're by yourself? Your first response is to want to cough and try to get it out, and you're going to do that automatically. And if it's not on there, it's not coming out, then you need to do something more. Number one, you want to remain calm, which is counterintuitive because when you're choking and you can't breathe, you're going to get panicky and you're going to have high anxiety, which is normal. Try to keep a clear head. Try to find a chair or some other kind of, a chair is best. Try to find a chair or another surface where you can kind of help yourself do the abdominal thrusts. So you're going to want to find a chair. Good rule of thumb is pinky on your belly button, then roll up. That's where you want to aim for. You're going to lean over it, and you're just going to thrust on top of it. Do it as many times as it takes to dislodge whatever is stuck in there out. It's going to feel strange because you're kind of landing yourself on a chair, but you need to get whatever is choking you out of you so that you can breathe again.
So we won't be really performing that. I don't think I have really like a chair that's really good, like at a really good position for me for my height. But if you want to perform it, you can always like look at it afterwards. We're gonna be sharing the slides afterwards, so you can definitely look at the video again and then practice it on your own. And next slide, please. Yes. So it's just some tips to prevent choking, especially I think just for children. Usually they suffer or they choke way more than like adults do. For children, we recommend like sitting while eating, because a lot of children, they kind of like walk around, or like they run around, they sit down, they sleep, like they try like laying down and they try eating, and that usually can cause them to like choke while they're eating. And just some other guidelines, like making sure to cut food pieces small and make sure to like chew your food thoroughly, are just really like ways where you can avoid choking from any any foreign objects. So yeah, that was just like quick overview of just Hammock Maneuver. So now we'll be just going into treating burns.
All right, next slide, please. So there are actually 4 main type of burns that people experience in their lives. The first one is friction, and friction burns are the result of a hard or foreign object rubbing against your skin with high pressure, and your epidermis, or your outermost layer of skin, is most affected by this kind of burn. So this is the type of burn you would feel when you skin your knee on like the gym floor at school, or you fall off your bike and you end up scraping your knees and elbows. The second one would be thermal burns, and these burns are caused by being located in, near, or touching an object that is a lot colder or a lot hotter in physical temperature than that of your body. So when I say a lot colder in physical temperature, that's kind of like frostbite, and for something being a lot warmer in temperature than that of your body, that could be like a hot stove, or a liquid, like when you're drinking a really hot soup or tea. And the third type of burn is a radiation burn, and these burns are experienced by being in an environment with high levels of radiation. And the pain level of this kind of burn actually depends on the case. So if you don't know yet, radiation is actually the emission of energy in the form of electromagnetic waves. So one very, very common radiation burn is sunburn, which is the type of burn you get from being in the sun for a prolonged period of time. And when I talked about the pain level of this burn being dependent on the case, chemotherapy patients who are taking part in like a chemotherapy program are actually experiencing radiation burn, but they just don't feel like the kind of pain you would feel from a sunburn or touching a hot stove. And the final type of burn is chemical burn. These burns are burns that occur when the skin is in contact with something that possesses an acidity level much higher than that of the skin. So you would experience this kind of burn if you fell and you have this huge scrape on your knee and your mom or dad wipes an alcohol wipe across it and it's really painful. Okay, so now I'm going to discuss the degrees of burns. So there's the first degree, and these are commonly referred to as superficial burns, or mild burns that mainly affect the outermost layer of your skin. These kind of burns can be treated easily at home with some aloe vera or a gel ointment. Second degree burn is a burn that affects the outermost to middle layer of your skin. In some cases, the innermost layer of your skin will be affected, and it can be pretty painful. So these burns can be treated at home as well with the proper and hygienic resources, but it's recommended that you go to a local urgent care center. And the third degree burn indicates an extremely severe burn that affects deep tissue and must be treated by doctors for the best treatment and recovery results. Next slide, please. Okay. So now we're going to discuss treatment. So for first degree or mild burns, you can run clean and cold water over the wounded area for 5 to 10 minutes as soon as possible. And after you clean the infected area, you treat the wound with aloe vera gel or some sort of ointment that a dermatologist or your doctor recommends to you. And to relieve pain, you can ice the wounded area with an ice pack for 1 week or until the pain is gone. As for medium burns or second degree burns, you can follow the instructions for the mild burns depending on how severe the burn is. And if it happens to affect the innermost layer of your skin, it's highly recommended that you go to a local urgent care center, as mentioned earlier, and follow any instructions they give you if you don't plan to stay at the urgent care center and rather treat it at home. And for third degree burns, it is highly recommended that you seek professional help as soon as possible. So in this case, you would dial 911 and inform the dispatcher on what the issue is and follow the dispatcher's instructions. You can use any clean cloth available at the time to bandage the wound and reduce blood loss. And I'm actually going to enter some resources or links regarding treatment for burns that you guys can refer to. Okay. And burn prevention. So how to avoid feeling the burn, because I have definitely had my fair share of being burnt. And the experiences I had could have been avoided pretty easily. So the first tip is to be aware of your surroundings. So if you're in an area where there are a lot of appliances, where radiation is very high, it's recommended that you just walk somewhere else so that you don't experience radiation burn. And As I mentioned earlier with radiation burns, they can be experienced in the form of a sunburn. So if you and your family members are planning to go somewhere where the weather is really hot, then dress accordingly and make sure you wear sunscreen. And rest in shady areas whenever possible. And you can also research resources or products that may be harmful to your skin, like bleach, hydrochloric acid, and alcohol, which are very high in acidity level. Okay, so now we're going to have a little break, and you guys, I'll send a link into the main meeting chat. And this is just a little Mentimeter for us officers to get to know you guys and your preferences relevant to our club. Or you can use a mobile device to scan the QR code on the screen.
Okay, I will start screen sharing now. And then you can click the link that Catherine sent in the chat, or you can also use the QR code that she was on the screen. And screen sharing now. Okay, a lot of mixed responses. I feel like during in the morning, I like coffee, but in the evening, I am a tea person. Like it changes for me.
For me, my go-to milk tea store would have to be Tasty.
Yeah, a lot of people love Tasty.
I really like their boba, like the green one in particular. I just vibe with it. I don't know.
I feel like my go-to is really not popular, but I really like T4.
I don't really go to like I don't know, milk tea is so expensive now. I'm not even working. Like Tasty is like if you get toppings and everything, it's like and you get like a large size, it's like $8. Like I could be using that for something else. But it does taste really good. All right, cool. So Tasty is in the lead and then Tea Pumps is last. So the next one. So what would you do on Friday nights? Play Among Us.
Wow, people get a head start on homework.
I would also get a head start on homework.
I should probably start doing that.
Nice. Okay. Very good students in this Zoom. Second is watch a good movie. Oh, okay. I really like zombie movies and like thriller movies, so send me recommendations if you have any. I recommend like watching #Alive if you're into like zombie movies, and Train to Busan is really good too. I watched like #Alive. I watched #Alive like a few weeks ago, and I was just like, oh my god, it's so cool. So yeah, I recommend watching that, and then pretty cool with all the little responses. So we'll just be continuing with the rest of the presentation.
Okay, so our next topic is strokes. So what even are strokes and what do they cause? So stroke is a disease that affects the arteries leading to within the brain. It's actually ranked 5th for cause of death and a leading cause of disability in the United States. A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked or so basically when we have blood vessels and if it gets blocked, it could cause a stroke and when it gets blocked, it could also cause our brain cells to die. So yeah, strokes are actually pretty scary. Okay, so these are a few signs of strokes. So please do pay attention if any, because in the future, if any of these things do happen to you or anyone you know to call 911 right away. So the first sign is sign of numbness or weakness in the face, arm, legs, or especially one side of the body. Having sudden confusion, not confusion as in being in your math class and not understanding anything, but confusion as in you're having trouble speaking, or it's really hard to understand what the other person's saying. The other sign of weakness, or no, sign of stroke is trouble seeing. And it's basically like you just can't see anything and everything's like black and blank in front of you, and you feel like super dizzy. So that's also another sign of weakness for having trouble walking, dizziness, loss of balance, or lack of coordination. And lastly, we have severe headaches. I know right now we're all going through headaches because of like the extreme screen time, but this headache is something that goes on for a pretty like decent amount of time, and it's really severe. And you would also see more signs of like numbness or confusion with these. So you probably will understand that you or the person is having a stroke. So again, please make sure you call 911 right away if you see any of these symptoms. So if someone is having a stroke, what should you do? Or how do you know like for sure if they're having a stroke? So there's a method called FAST, which is also like react fast to it. So F is face, where you ask the person to smile. When they're smiling, look at their lips. Like, is one side more like curved than the other? The second is arms. Ask the person to raise both their arms and check if like one arm is more higher than the other, or is it hard for them to like get the other hand up? S is speech. Ask the person to repeat a simple phrase. Maybe like Sally went to the salon or something. And are they like slurring it? Is it hard for them to understand? Are they telling you to repeat what you said, even if you just said like hi and they don't understand? And time, which is T. If it's really, really important to act fast for strokes. So if you see any of these signs, again, please do call 911 because early action is very important for a stroke. And here are a few statistics about strokes. So someone in the United States has a stroke every 40 seconds, and every 4 minutes someone dies. Like I said, it's ranked number 5 in cause of deaths. Every year, more than 795 million people in the United States have a stroke, and about 610 million of these are first or new strokes. And so about 87% of all these strokes are ischemic strokes, in which the blood going to our brain gets blocked. And a stroke is a leading cause of serious long-term disabilities. That's why I keep repeating and stressing the fact that it is really important to act fast. And also the risk of strokes they vary from race, ethnicity, and age. So it is said that like the more you grow, the more chances you have of getting a stroke, or the more you age. And some causes of strokes could be high blood pressure, high cholesterol levels, smoking, obesity, diabetes, and 1 in 3 US adults do have these like blood pressure or like obesity, diabetes. So please do, again, make sure that you know the signs and remember the method FAST, so you could prevent someone from, their conditions going worse.
So just here's some helpful courses, and then Shigin will be sending the links into the chat, or the link in the chat. And this is kind of a website that I found. It offers free online courses they have CPR, first aid training, self-defense, a lot of different courses, and all of them meet American Heart Association and Occupational Safety and Health Administration, or OSHA, guidelines. So the only thing you'd really have to pay is if you'd want to get a certification for it, but you don't really necessarily need one. You'd only like want it if you'd need it for like maybe a job requirement or anything like that, but definitely recommend checking it out. It's really helpful. And now, next slide, please. So please don't forget to rename yourself with your club, grade, and full names so that Shagun can enter the participants, and then Catherine will be taking your pictures. So make sure to before we start, maybe we'll wait like a few seconds just to see if people show their face or anything, and then we'll be posting this on our Facebook page too.
I was muted. Please turn your cameras on if you have one that works. And I will count off since there are 2 slides. Okay. 1, 2, oh, someone's doing their hair. Okay, 1, 2, 3. Okay. And I gotta paste this in a okay. And the next slide, 1, 2, 3. Thank you, guys.
All right, so this is just kind of a reminder to we really recommend you guys to attend the rest of our PHHS Health Week, and you can find the event page right over there, and I'll actually send a link into the chat. But tomorrow is actually going to be our American Heart Association club, and then they'll be going over the CPR training and also be leading a heart activity. So you can sign up there. Follow our event page. All of the flyers and sign up links are there. And Bring Change to Mind is on Wednesday. They're going to be going over some self-care tips and techniques. Be really fun. And then on Thursday is actually going to be American Cancer Society. So they'll be doing like a really fun cancer scribblio and also doing lung and stomach cancer. And then finally to wrap it all up, Red Cross is going to be ending on Saturday, and they'll be going over like natural disasters. So we really encourage you guys to follow us on our event page. You can click going and you'll get any updates on information about that. And next slide, please. That's basically it. So thank you guys so much for attending. Follow us on our social media platforms to get updates. We'll be posting these slides after the meeting too on our Facebook and also our Instagram. And we'll also be following up in today's earlier email. So thank you guys so much for coming. If you guys have any questions, you can stay afterwards. But that basically wraps it up. Thank you guys so much for coming. Bye-bye.